Hello friends, in today's video I will be talking about Hodgkin's lymphoma. So let's get started. Let's first talk about lymphopoiesis. Well, you all know that lymphopoiesis starts from a hematopoietic stem cell. This hematopoietic stem cell undergo transformation to a common lymphoid progenitor, which further transforms to lymphoblast, prolymphocytes, and then small lymphocyte and natural killer cells are formed. These small lymphocytes are of two types: B lymphocytes and T lymphocytes. So, this B lymphocyte is the precursor cell for development of Hodgkin's lymphoma. When there is neoplastic proliferation of these B lymphocytes, then there is development of Hodgkin's lymphoma. Here I have shown a lymph node structure where you can see the capsule, which is outermost, and then there is cortex, and innermost is the medulla. And in the cortex, you can see follicles which have germinal center, a mental zone around it. So this is the structure of lymph node. So, as I have told you, Hodgkin lymphoma develops when B cell, a type of lymphocyte, mutates and multiply out of control. This mutation disrupts the process that regulates cell growth, reproduction, and death, and allow the abnormal cells to accumulate in the lymphatic system. These abnormal cells, known as Reed-Sternberg cells, are binucleated and pathognomic to Hodgkin's lymphoma. These Reed-Sternberg cells are of different types like classic, lacunar, pleomorphic, popcorn, and mummified. The classic Reed-Sternberg cells, which is seen in classic Hodgkin lymphomas, are large cells with abnormal nuclei, which is binucleated and have prominent eosinophilic nucleoli. And this appearance is known as owl's eye appearance because it looks like the eye of an owl. Other types of Reed-Sternberg cells are mononuclear cell variant, which is also known as Hodgkin cell, lacunar cell variant, which is seen in nodular sclerosis types of classic Hodgkin's lymphoma. Then there is a mummified cell variant, which is not pathognomic of any type of Hodgkin's lymphoma. The other variant is pleomorphic variant, which is seen in lymphocyte depleted classic Hodgkin's lymphoma. And lymphocyte predominant Hodgkin's lymphoma shows popcorn type of Reed-Sternberg cells. Now, mind you, these Reed-Sternberg cells are not only seen in Hodgkin's lymphoma, they can be seen in many other conditions also. But the appearance of Reed-Sternberg cell in lymphomas will give you a clue of Hodgkin's lymphoma. Now, as I told you, Hodgkin lymphomas are of two types: classic and nodular lymphocyte predominant or non classic types. Now, there is immunophenotyping which helps in differentiating in both of these. The classic type is positive for CD15 and CD30, and nodular lymphocyte predominant type is negative for CD15 and CD30, but positive for CD20 and CD45. The classic type has four variants: nodular sclerosis, mixed cellularity, lymphocyte rich, and lymphocyte depleted. The non classic type is just one variant, nodular lymphocyte predominant. Talking about nodular sclerosis variant of Hodgkin's lymphoma, well, this is the most common variant and it occurs especially in young adults. In this, neoplastic cells are surrounded by collagen and form nodules, thus the name nodular sclerosis. In this type of lymphoma, lacunar Reed-Sternberg cells are present and they have good prognosis. As you can see here, the bands of sclerosis are forming nodules, and the lacunar cells are appreciated as I have depicted by the arrow. The mixed cellularity variant is the second most common type of variant, and it is especially seen in old age. Here, the neoplastic cells are mixed with neutrophils, eosinophils, plasma cells, histiocytes, etc. in the background, and classic Reed-Sternberg cells are present. They have a very good prognosis. As in this image, you can see I have depicted by the arrows the classic Reed-Sternberg cell, the plasma cell, and the eosinophils. The lymphocyte-rich variant has an excellent prognosis. There is a rich lymphocytic background with presence of classic RS cells in this variant. The lymphocyte depleted variant has the worst prognosis. In this, pleomorphic RS cells are present and there is no reactive lymphocytes in the background. This is the rarest form of classic Hodgkin's lymphoma and is prevalent in HIV positive individuals. The non-classic type of Hodgkin's lymphoma, also known as nodular lymphocyte predominant type of Hodgkin's lymphoma, is more common in males. In this, the abnormal B cells, in spite of expressing CD15 or CD20, they express CD20 and CD45. These are slow growing, and in this, popcorn type of Reed-Sternberg cells are present, and there is small risk of transformation to aggressive form of non-Hodgkin's lymphoma. Mind you, in this popcorn type of cells are present. Talking about Ann Arbor staging, this staging is done for Hodgkin's lymphoma as well as non Hodgkin's lymphoma. In this, if there is one lymph node involvement at either side of the diaphragm, then it is known as stage 1. If two lymph nodes are involved at either side of diaphragm, then it is known as stage 2. If there are more than two lymph nodes involved on both sides of diaphragm, then it is stage 3. And if with stage 3 features extranodal sites are involved, then it is stage 4. Coming to the clinical features of Hodgkin's lymphoma. Well, in Hodgkin's lymphoma, there is painless lymphadenopathy. Alcohol induced lymph node pain is a very characteristic feature of Hodgkin's lymphoma. When people who drink alcohol, they have pain in their lymph nodes. Fever, night sweat, weight loss are the part of the B symptoms. Also, patient can present with chest pain and cough and pruritus. And when there is splenomegaly, the patient can present with nausea and anorexia. Also, they can present with pleural effusion, pericardial effusion, and superior vena cava syndrome, because these are adjacent to the mediastinal lymph nodes, and mediastinal lymph nodes, if commonly involved, then they can affect the pleura, pericardium, and the superior vena cava. For diagnosis of Hodgkin's lymphoma, lymph node biopsy is done, in which presence of Reed-Sternberg cells is very important. Other scans which can be done to detect the extent of lymphomas are PET scan, CT scan, MRI scan, lumbar puncture, bone marrow biopsy, etc. For treatment purpose, combination chemotherapy is done. For stages 1 and 2 classical Hodgkin lymphoma, adriamycin, bleomycin, vincristine, dacarbazine is given. And for stage 3 and 4 classic Hodgkin's lymphoma, bleomycin, etoposide, adriamycin, cyclophosphamide, oncovin, procarbazine, prednisolone combination is given. For non-classical Hodgkin's lymphoma or nodular lymphocyte predominant, which is CD20 positive, rituximab is given.